Celiac disease is an autoimmune disorder of the small bowel that affects the distal duodenum or the proximal jejunum, and generally with the consumption of bread and cereals, these patients are presenting with relapsing diarrhea. So this type of disease has been associated with the human leukocyte antigen DQ2 and DQ8. So the presence of these gene loci puts an individual at increased genetic susceptibility for the celiac disease. Now, as for the pathophysiology of this disorder, it's caused by the consumption of the dietary gluten, which contains gliadin, which is a component of the wheat storage protein, and so therefore there would be formation of the autoantibodies against the gliadin. In addition, there are formation of the anti-endomysial antibodies that will target the transglutaminase. So anytime on the exam you see antibodies that are formed against either gliadin, endomysium, or the transglutaminase, then you should start thinking of the celiac disease. Now, the function of the transglutaminase is to cross-link the glutamine-rich proteins, like for instance the gluten. So gluten is being affected by the transglutaminase, and then one other function of transglutaminase, in addition of cross-linking glutamine, is to convert the glutamine residues of the gluten into the glutamic acid. And then glutamic acid has a negative charge, which enhances binding of proteins into DQ8 and DQ2 gene loci, as a consequence of which they would potentiate the capacity to stimulate T cell production. So therefore, these patients, because of the stimulation of the T cells, are at increased risk of the T cell lymphoma. In addition, the other function of the transglutaminase is for the epithelial differentiation. So therefore, if there is no problem with the transglutaminase due to the formation of the antibodies that will target transglutaminase, therefore there won't be any more epithelial differentiation in the intestine. And so therefore, the kind of findings that you see with the celiac disease is characterized by mucosal inflammation as well as the villus atrophy, since now there is no more differentiation of the intestinal epithelial cells. And so due to the villus atrophy, these patients generally present with symptoms that are related to malabsorption, like for instance diarrhea, staturia, as well as weight loss. And so here is an example of histology of celiac disease. So you know how the villi in the duodenum as well as the jejunum should be like this. And so here you can see how there has been villi atrophy with the celiac disease. As for the diagnosis, you can check for the presence of the anti-transglutaminase or anti-endomysial antibodies. You can also check duodenal biopsy for the villus atrophy. And then there is this D-xylose test, which is not very specific, so it's not really recommended over the other two techniques. So what happens with D-xylose is that it's the monosaccharide that does not need digestion for absorption, but rather it relies on an intact intestinal mucosa for absorption. So conditions like celiac disease, where there is intestinal malabsorption, presents with a positive D-xylose test, meaning that there is low level of D-xylose excretion in the urine due to the problem with the absorption of this monosaccharide from the GI tract. Now, the complications that may arise from the celiac disease, as we just discussed earlier, due to the activation of the HLA DQ2 and DQ8, there is increased risk of the T cell lymphoma. In addition, these patients are at increased risk of dermatitis herpetiformis, where the IgA antibodies that are formed against the endomysial and transglutaminase can deposit in the papillary dermis, as a consequence of which it presents with the pruritus. And so here is an example of the skin lesions that you see with the dermatitis herpetiformis. Alright, now here I have provided you with a memory aid to summarize the findings with the celiac disease, and it's called CAGED. So celiac disease is a type of disease that is associated with villus atrophy. And so there is also gliadin antibody in addition to the anti-endomysial antibodies. And then what is the third antibody that you should know of? It's the transglutaminase. So in fact, it's the antimicrobial antibody that will react to the transglutaminase, and so the other name for it is anti-transglutaminase. In any case, for the diagnosis of celiac disease, you can check for the presence of the endomysial antibodies. You can also check for gliadin antibody, but they're not as specific. You can also check for D-xylose, which shows the intestinal malabsorption of this monosaccharide. You can check for the duodenal biopsy. So all of these came with caged D. And then these patients also present with the dermatitis herpetiformis. And that concludes our discussion of the celiac disease.